Hey everyone, I'm Dr. Phil DeVasto. I'm here at Hosmer Chiropractic Health, and what I want to review with everyone today is the best way to use their foam roller to loosen up their low back. What we're going to do is we're going to take this and we're going to spend a lot of time mobilizing the joints throughout the lumbar spine in that low back, and it's a great exercise, I would say daily, to just kind of keep the back mobile, less likely to have injuries in the future, and can really help reduce pain and stiffness in the back. So what we're going to do to get into this thing safely is we're going to start laying on our backs. Hips will be bent, feet will be flat on the ground. So we're going to start laying on our backs and the roller is going to be next to us. The safest way to get into this thing is to kind of go up into a bridge and slide the roller underneath. And where I want you to be to start is not anywhere up here in the low back. I want you to be nice and low. Think about being below the belt line, almost underneath the hips. So that way, when I put full weight back down into this thing, I don't feel any pressure yet in the low back. And what we're gonna do from here is I want you to think about using your body to just kind of scoot down until you feel like that roller just enters the low back. And once you're at that very, very bottom joint in the low back, we're just gonna hang out here and breathe. The goal is gonna be to spend a full minute in each of these spots. We're going to work our way up slowly through all the joints, but this first one is where we'll start. And I don't want you moving around too much here. What we're trying to do is just kind of relax our glutes, we're trying to relax our quads, and we're just trying to almost like melt over this roller a little bit and really get a lot of extension. If you could picture the two joints of the back here, what we're doing is just kind of extending over. We're getting a good deep stretch in through there. It helps sometimes if you kind of can take a few deep breaths while you're in here. And what I like to think about is on the out breath, kind of relaxing a little bit further into this. Again, a minute on every spot is the recommended time, but if it felt really tight and a little bit too painful for you, you can always roll on to the next spot. So let's talk a little bit about pain while we're in here, because some of you might feel a little bit of pain, and that's okay. What we want is we want you to be in that good pain range. Nothing should be shooting, nothing should be electrical or stabbing type pain. No sharp pain here. We're just looking for like a little bit of a dull ache, and we'll call that a good pain. And keep it in that good range. For most patients, it's like up to maybe like a 5 out of 10 on the pain scale. And always feel like you can roll on if it's too intense for you at any one spot. So we've probably spent about a minute at that first spot. So all we're gonna do from here is I like to maybe use the back of my head, my elbows, my shoulders, and just scoot myself down. You can kind of reset the feet and feel like you're in a completely different spot, which I am here. And again, we're just gonna repeat. We're gonna hang out here for a minute. And now I have a lot more weight of my hips on the south end of the roller here, so I have more pressure pushing down, and it gets a little bit more intense as you go up. So if a minute seems crazy, just do what you can do, and that will be your baseline. So while we're here, the one other thing I want to talk about is if you did hit an area where it was really painful and you just felt like you needed to get out of it real quick, I wouldn't want to ever see anyone just kind of like jump off the side of this thing or just try to roll over quickly. We're in a really compromised position here with regards to our joints. So the emergency way out is going to be squeeze your glutes nice and tight, drive your heels into the ground, and go right back into the bridge. And from there, you can try to kind of ease back into that same stretch, or you could just pull the roller out and be done with it. So that's going to be our emergency way out. But as we continue to work our way up the back, you're going to feel a pretty different kind of stretch on each one of these joints. And you're just going to take it all the way to the top of that lumbar spine, stopping for a minute on every spot and just really seeing if we can get those joints to loosen up pretty deep in there. This is going to feel different than most low back stretches that you do, because what we're doing here is we're actually letting the muscles relax over, and we're getting a deeper stretch into some of the structures like the joint and the disc and the joint capsule and some of the stuff that doesn't typically get stretched. So it's going to feel a little bit different, especially if you're new to this. So we know we've gotten to our last spot when I can't really roll any further. If I wanted to go further, the only way that would happen would be if my shoulders came up, and we do not want that to happen. So shoulders are always flat down. And so once I get to that top spot, we're going to spend our minute there, and then we're going to show you the nice easy way out. So the way we're going to get out of this is the same way we got back into it. We're going to go nice and slow, kind of using my elbows, kicking out onto my heels, And once you get back underneath the hips, I want you to pull one knee up at a time. I want you to push your butt away from you and drop into a little bit of flexion here. This should feel really good, especially if you just spend 5 or 6 minutes with everything in extension. I want you to just get a good flexion stretch, back down into the bridge, and slide on out. So give that a try and let us know how your back feels after.